You're watching the Fox 8 10 o'clock news with Neill McNeill, Katie Nordine, and Max Weather Chief Meteorologist Van Denton.
Tonight's Newsmaker is the head of a brand new school that's training students to do things that may one day save your life.
It's the nation's 135th, North Carolina's 4th, and the Piedmont Triad's 1st pharmacy school. The inaugural class of 40 students arrived at the Fred Wilson School of Pharmacy at High Point University last month. What they'll learn over the next 4 years will closely parallel your health care. And staying on top of such a constantly changing profession won't be easy. It could be the most unusual transformation ever of a former bank branch. It's a few hundred yards from High Point's Ocala Mall. The sign on the door tells the story. Inside this room where money used to change hands, different types of exchanges are taking place.
Here's another similar to insulin. We're not going to talk about this one in particular, but I'll let you guys see what that one is like as well.
Exchanges of knowledge. Welcome to the temporary skills laboratory of High Point University's School of Pharmacy. It's temporary because the lab and the rest of the pharmacy school facilities will move into this, the university's $60 million health sciences building, next spring.
All of our students will have 2 different class sessions each semester in here until we move into our new building.
These students will learn everything from how to fill prescriptions to how to teach customers how to use inhalers. When they put on their white coats for the first time in this special ceremony at the start of the semester, they begin a 4-year program that will result in each having a Doctor of Pharmacy degree, a degree all new pharmacists in the United States must have to become licensed. Dr. Ronald Ragan, his last name spelled without the letter E, is the school's founding dean.
Who are these people?
They come from all over. Interestingly, a large percent of them came from right here in North Carolina.
What sets this program apart from all other pharmacy schools out there?
We have loaded throughout this program numerous experiences for students to interact with patients, both real patients and actor portrayals of patients.
You've actually hired actors to work with these students.
Yes.
In fact, Dr. Ragan feels communicating successfully with their future customers will be just as important as their scientific knowledge. Explaining the ever-changing complexities of medications effectively will be crucial for the pharmacist of the 21st century. As for where you'll go to encounter these aspiring pharmacists and the services they provide, Dr. Ragan says the rapid change we've seen in the industry will continue. There will be the traditional community drugstore.
Do I think community pharmacy is going away? I really don't.
But there's been a lot of consolidation among the chain pharmacies in recent years. You can also find a pharmacy in just about every big box store or supermarket.
I think the next area where we're going to see a lot of growth is in medical practices, where you've got a pharmacist in a practice where run by a physician and with some extenders and maybe some other ancillary support help. But the pharmacist then bringing that drug therapy piece to that group at the point of care.
Since so many doctors are prescribing electronically now, how nice is it not to have to decipher a doctor's handwriting?
Yeah, I know. I knew that was coming. It's great, assuming they pick the right drug on the pull-down menu. So now our job is partly to say, all right, does this drug really match with what the patient's telling me their disease is?
So this school will have to prepare these students to handle all things pharmacy, to work in different environments, and to connect with the people they serve.
Before they even started classes, they had conducted almost 200 hours of community service. That's part of what we do as a profession. We go out into our community and we help people understand their medications, healthcare in general. You know, our product isn't only the tablets in that vial.
As many of you know, the number of mail-order pharmacies has grown in recent years as well, but Dr. Ragan says he doesn't see them as a threat to these aspiring pharmacists finding jobs. He says there is very limited or no unemployment in the profession. He also reminds everyone that pharmacists today can give immunizations and that it's always important to talk to your pharmacist to make sure you understand everything about the medication you're taking. For more information about the new pharmacy school, just take the link to its website from this story on ours, myfox8.com.